Welcome, my name is Nasan. Today we want to talk about signs and symptoms of diabetes mellitus. Diabetes mellitus is elevated blood sugars in the body, and therefore it is good for us to know what are some of the signs and symptoms of this diabetes mellitus so that we can be able to seek assistance on time. One of it is having an urge to eat more frequently. When you develop this urge of eating more frequently, it can be an early sign of you having diabetes mellitus. This is what we call polyphagia. When you eat a lot, your body is also sensitized to need more or extra fluid, what now is called polydipsia. You are taking in a lot of water. There is increased thirst. So when you are eating, you want to eat a lot and you want to drink most of the time, your kidneys are also sensitive that there is an extra work it has to do. Therefore, it will work extra hard to eliminate this extra fluid that you are taking in. That's what we call polyuria. So you end up having frequent micturition. There is also delayed wound healing. When you have delayed wound healing, this is because there is reduced blood supply to the wound site. Therefore, there is reduced white blood cells that are responsible for wound healing. Another sign is you have frequent urinary tract infection. Urinary tract infection, there are some microorganisms that are they like staying at the sugary place. Therefore, they end up affecting your urinary tract infection, making you to have frequent infection. There is also blurred vision. You feel like you are not seeing clearly. Make sure that you see your ophthalmologist on time. This is because when there is elevated sugars in the body, there is what we call water pooling from retinal tissues. In diabetes, it's called diabetes retinopathy. Therefore, when there is pooling of water from the tissues, there is reduced acuity. You are not able to see clearly. Therefore, it is good for you to seek medical advice or ophthalmology to check if there is any other cause that might have caused this. There is also what we call increased weight loss. When you have insulin intolerance or your insulin is affected, it cannot be used well in the body. Your body now opts to use your muscles and your calories or your fats in the body. Therefore, when it uses your fats and your muscles, you end up having massive weight loss. This is because it's breaking down your fats and your muscles to use so that other body activity can go on very well. You also have pin and needles or tinkling. Your nerves are affected by high sugars. When they are affected, you'll start having pins and needles in your hands and in your legs. When you start feeling this, it's always good for you to seek medical advice before you lose sensation completely. This is because as time goes, your sensations are affected completely and you might not feel anything. You will also have red and swollen gums. This is because of decreased immunity in the body. When there is decreased immunity in the body, there is increased chances of you getting infection, and your gums are tender to this low immunity. Always when you see this, it is always good for you to seek your medical advice. Or if you have someone in the family who has diabetes, it's also good for you to keep checking your sugars if you see any of these signs of diabetes mellitus.